Greetings from IMA. I am Dr. Shalini Chawla Khanna. I am a consultant at Max Panchi, specializing in infertility and laparoscopy. What is infertility? Infertility is defined as inability of the couple to conceive after 1 year of unprotected physical relation. It affects as many as 1 in 6 couples or 10 to 15% of the reproductive age couples. Why is infertility on the rise? The infertility is on the rise as women are postponing childbearing either because of the social, economical, professional or psychological reasons. Stress, smoking, alcohol, toxic chemicals and drug exposures and nutritional deficiencies or excess, they can all negatively affect the fertility. What's that? Why is infertility related only to females? No, it's a myth that infertility is caused mainly due to problems in the females. In 1/3 of the patients, the infertility is caused due to causes in the females, like tubes may be blocked, or she may not be ovulating or forming a good egg, or there might be a fibroid or endometriosis. In 1/3 of the cases, the male may be responsible for the causes of infertility, like there may not be any production of semen where the may be azoospermia, or there may be decreased production of sperms. And in 1/3 of the cases, both the partners are responsible for infertility. And in 10% of the cases, we are not able to elicit any cause and we label those patients as unexplained infertility. How do we evaluate the patients, such patients? The evaluation for the infertility begins with evaluation of both the partners. The male is evaluated for one basic semen analysis and the female is evaluated for the fallopian tubes either by the hysterosalpingography, by the sonosalpingography or by laparoscopy. Even her ovarian reserve, which can be detected either by the blood test such as the anti-Mullerian hormone, serum FSH hormones or serum E2 hormone levels, to be done for the ovarian reserve assessment, or the ovarian reserve assessment can also be done one basic ultrasound to see the antral follicular count. Simultaneously on the ultrasound, we can see her uterus to rule out any pelvic pathology like endometrioma, fibroid, and specifically to look for the endometrial thickness. After the evaluation of both the couples, the treatment is individualized and the treatment may vary either from simple procedures like ovulation induction, where the drugs are given to a female to form the good number of eggs, or she may require an IUI where the male partner gives the semen sample in the laboratory, where we process the semen sample and put the highly motile sperms into the female uterine cavity, which this process is called as IUI. The laparoscopy or the hysteroscopy surgeries may be done as the tubal reconstructive surgeries, or to remove fibroids, or to remove endometriomas. The highly specialized techniques like IVF, where the woman is stimulated to have the multiple number of eggs in her ovaries, and as the eggs mature in the IVF laboratory, the same day the male partner gives the semen sample. Both the eggs and the semen are processed in the laboratory and cultured for 2 to 3 days, and after 2, 3 or 5 days, the embryo which is formed is transferred into the female uterine cavity. The technology has advanced so much. The new technologies like ICSI, intracytoplasmic sperm injection, which is done mostly in cases of very low sperm count or there is no sperm at all, has revolutionized the treatment for infertility. With the advances in the technology, most of the couples are able to conceive, and the results of the ART, assisted reproductive technologies, has really gone up. Thank you.